Hi, this is The Health Chat. I'm your host, Andrew Whitfield Cook. Rebecca Hughes is a naturopath with many clinical interests, but she also has vast experience in the regulation of natural medicine. She's well known for her management approach of acne and also atopic dermatitis. But today we'll be talking about another area of interest of hers, and that's pediatric health. Welcome to The Health Chat, Rebecca. How are you?
Thank you. It's always a pleasure to talk with you, Andrew.
So, Rebecca, let's discuss this. So we're talking about juvenile idiopathic arthritis, correct?
Yes.
Okay. Let's delve into first a little bit about the pathology of this. Tell us a little bit about the signs and symptoms first.
Yeah, well, it occurs, in terms of incidence as well, it occurs in children generally between the ages of 2 and 12. That's what qualifies as the juvenile part of the diagnosis. And it's roughly 1 in 1,000 children are diagnosed with juvenile idiopathic arthritis. And I think there's roughly about 5,000 children in Australia at the moment with that diagnosis. And idiopathic meaning that it's of unknown cause, like we don't know why the arthritis has happened. And it usually, it looks like mostly swollen and enlarged and inflamed joints, but there can be other sort of complications that occur in some patients, but not all. For example, there might be dermatitis associated with it. There might be myositis, which is muscle inflammation. And in some cases, even, I never know how to say it properly, uveitis, which is an inflammation of the middle layer of the eye. So that can happen as well.
Okay, so just a little point on the age with pediatricians and then adult medicine, if you like.
Mm-hmm.
There's that inter-age gap there. Now, you said up to the age of 2 to 12, right? How is somebody from 13 to 16 treated?
Oh, I have no idea. I just know that the incidence of the onset of the condition, it's well known to appear within those ages. So
Right.
It's quite possible then that it doesn't appear as regularly in teenagers, but does. But the actual juvenile idiopathic arthritis occurs more in toddlers and primary school age children.
And when we're talking about JIA, is it then transitioned to rheumatoid arthritis in the adult years? How is it termed once
It's
they grow
actually
older?
got a progress of roughly 2 years. And so in most cases, the condition will resolve and not automatically, well, from the literature, it's unclear, will it resolve on its own, right, or will it resolve in 2 years under general medical care? Because that's most of the literature, of course, is on children who've received general medical care according to the clinical practice guidelines, and their condition resolves within 2 years. So it's not an automatic progress into rheumatoid arthritis in later life, or even even into teenage years. It's just considered to be a juvenile condition.
Right, okay. And then when you say 2 years, what's the prognosis after that time? Like I'm thinking about joint deformities, tissue destruction, localized tissue destruction, things like that.
Yeah, I think depending on, I suppose, how well the disease has been managed during the active phase will determine how much tissue damage there is, because with any kind of arthritis, regardless of whether it's autoimmune or osteoarthritic or rheumatoid arthritis, or there's always some thickening that generally happens to connective tissue, which is going to cause joint changes. So I guess I don't know that there's a predictable outcome for that, and that's why the general medical management is aimed at lowering the inflammation as quickly as possible. So that's why quite potent drugs like methotrexate and prednisolone are used, and more recently there's the use of biologicals as well.
Right, of course. The biologics, the latest blockbuster drugs, the MABs. Okay, so we're going to be discussing a particular case today. So can you take us through the particulars of this case, how this patient presented?
Yeah, of course. So Tamara is 7 years, well, she was 7 years old when her mum first brought her to see me. And that was in June 2020. And they had been to the pediatrician in March 2020 and given the diagnosis of JIA based on blood work and imaging and clinical signs and symptoms, and all other possible differentials had been ruled out by the pediatrician. They weren't sure at that stage whether she had myositis complications because it was fairly early in the disease progression, but it was very clear when she came to see me that there were joint and dermal manifestations of the disease. And when she came to see me, her hands, the joints, in her hands, the metacarpophalangeal joints and I think the distal into the dips, they were inflamed, but actually pips and dips. So so these joints, and these joints.
Yep.
And then also the skin around her fingernails was very inflamed and swollen.
Right.
In addition to that, there were small isolated areas which looked like almost looked like a mosquito bite. And they were some of the first things to appear, apparently, when the condition started. She had decreased range of motion in her wrists and decreased grip strength, and had lost 2 kilos of weight. And how she visually looked was very sort of sallow, like sort of gaunt, thin, very white, and quite dark circles underneath her eyes. So she didn't look like a well child. And there were other behavioural characteristics that her mum reported around mood modulation issues. So a lot of tantrums and angry outbursts and school refusal as well.
Okay.
Also happening.
What about temperatures?
No, she didn't have a fever. That's one of the JIA presentations. You can have this systemic fever, etc., but she didn't have that. There was a history of, in the 12 months leading up to it, having being susceptible to colds and coughs and flus. So she was a little bit run down and sickly. And her mum freely admitted to me, she said, look, we have a busy household, and she just hasn't probably been having a very good quality diet, and she craves a lot of sugar, and that's the kind of food she's been having, a very standard Australian diet.
Okay. So what about her medical journey? Because I guess we've got to start somewhere, and these kids should be, their first access to medical care should be, obviously, I said that really badly, their first access to healthcare should be a medical professional, correct?
Absolutely. I mean, I could not have made that diagnosis. That needed to be done by a pediatrician.
Yeah.
Yeah.
So take us through her medical journey.
Well, I mean, the medical journey was, her mum saw that this pain and the swelling appeared and took her straight to the GP. The GP immediately referred to the pediatrician, and that all occurred very rapidly, and the imaging and the blood work, as I said, confirmed the diagnosis of JIA. And then the family were given, it was spelled out to them what was planned for Tamara, which was basically 2 years worth of methotrexate and prednisolone was considered to be the standard medical care for this particular condition. And her parents were very, after reading about these types of drugs, particularly her mother was very concerned about the long-term side effects of the drugs. She was as concerned about the drugs as she was concerned about the disease. And she was very confused about what to do because, of course, You would be. You've got a young child who's got this terrible disease that could cause deformities, and then your only option is to give chemotherapy, essentially.
Yes.
And
And it's
and
not without its risk. You've got, if you're on high dose steroids, you've got potential bone issues, potential cardiac issues, gastric ulceration issues. There's a whole
injections,
plethora.
yeah, suppression of bone marrow. There's many nasty side effects for those kinds of medications. And I'm not saying that it's bad, because there's plenty of evidence to show that it has worked for treating JIA. But at the same time, I suppose one could argue, well, I don't think that the drugs are treating JIA. I think the drugs are lowering the impact of the disease on the human body by reducing the swelling and damage to the joints.
Yeah.
That's what the drugs are doing, but because the disease will run its course.
So, but how often do you see that in medicine? Etiology unknown, treatment symptomatic. I mean,
yeah, it's common, but I can understand in a child why it would be addressed so aggressively.
And notwithstanding that, you've also got psychological issues there. I mean, she's already acting up in school, as anybody would. They'd be so frustrated with their body. They'd be in pain. Anybody gets crotchety with pain. I mean, yes. Heaven forbid it's a male, because women put up with pain all the time. But I mean, it must have been horrible for this little girl. She's got, normally in that very active phase of her life. So yes. She can't do sport. She can't go out and play. How did that impact on her lifestyle?
Yeah, she couldn't do sport. She couldn't do handstands and cartwheels and all those fun things that kids like to participate in. Couldn't bounce on the trampoline with her brother anymore because there were just too many options or opportunities for injury, and she lives in a semi-rural area, and she loved, she's likes all these activities like dirt biking and water skiing, and there's no way that she could possibly participate in those activities because she could barely even turn on a tap.
Wow. That's just devastating. Okay, so they live in a semi-rural area. You practice in Melbourne. How do they find you?
I'm not entirely sure. They might have, I think they listened to a podcast about functional medicine as part of their research around what are the alternatives. And it's through the pathway of functional medicine that they arrived at our practice.
Gotcha.
Yeah.
All right. So tell us then about how you help this little girl.
Well, I think we've talked about this before, Andrew, that, diagnostic labels are useful for talking about a cluster of symptoms, but they're not necessarily useful, in my opinion, for very much else, because I'm treating a sick child, not just JIA. However, I am also treating a sick child who has a dysregulated immune system. And so the first place I go to with anyone who's got, whether it's autoimmunity or atopy, is starting to dig into why. Like, can we find anything that could be the initiating event? Possibly. Sometimes you can find that, sometimes you can't. The initiating event has come and gone, and there's absolutely no evidence of it any longer, because it might have been just a virus, that caused it to happen. And then looking for anything that could be maintaining the aggravated immune system. And then also looking for anything that could be just compromising overall general function and health of the entire body. Because if there's anything in the way that is basically a barrier to cure or a barrier to healing, I think that's really important to identify, regardless of what the disease state is.
Okay. So, sorry, you go.
Some of the investigations I did were food intolerance testing, so IgG immunoglobulin testing, and we found significant reactions to foods in that testing. Now, whether or not, and I think this is interesting in food intolerance testing, is is the body reacting to the foods because there's an intrinsic issue with those foods, or is it because the body is already inflamed and in the process of an autoimmune cascade, so then it starts having reactions to foods? And I don't think there's an answer to that question, but I think it's worth keeping it in mind that it's not really natural for the human body to have multiple food reactions. It's more a sign, I think, of the system that the foods are going into, not the other way around.
Yeah, I totally agree with you. It's been one of my hesitations with a reliance on food intolerance and other allergen testing too much.
Yeah.
You know, like use it in a context, sure. But I totally agree with what you're saying. We need to put it in a context of what's happening with that patient at that point in time. Because I've seen food intolerances change, and not just food intolerances, you know, dust mite, grass, cat, you know, even the big ones, you'll see them go through a flare and then they'll settle down.
And another, just as a side note, because I'll come back to the other investigations, but one thing I talk to a lot about with the parents, because I treat a lot of children, is think about the size of your child and then think about how much food that child can eat. And children are growing and they can eat as much as an adult, if not more at times. And so if you think of the dose of food per kilogram of body weight, there's a very high exposure of foods. And then if you think about that children have strong food preferences, especially at different times of their development, they will only eat 3 foods and nothing else will pass their lips. So there's certainly, you know, it's not uncommon, especially for toddlers, you know, a whole punnet of raspberries.
Yeah.
So that's a lot.
I eat them and I'm 55.
I know. And so it's a lot of food antigen coming into a small system with organs of detoxification that aren't fully developed yet as well. They don't have necessarily the same capacity of liver function as an adult. So I think there's a lot of biological considerations as well with foods, because there's different body sizes ultimately. So when allergists and say, oh, your child could grow out of their allergy, I don't think necessarily they grow out of the allergy. I think just that they grow and there's more of them to deal with the food antigen.
Yeah.
So that's just my opinion.
They're still atopic. You're still atopic as an adult. It's just whether it presents or not. Can I just sort of go back a little bit, and that's to do with the diet. Prior to the presentation of symptoms, was this girl's diet pretty well? And tell us a little bit also about the family dynamics. Was there any stressors in the family? Were they a well-adjusted family? You know, they get on with siblings, all of that sort of thing. What was the psychological issue there, the psychological aspect there?
I think that the family dynamics were pretty typical. I don't think there's any particular, and she's got really great relationships with her grandparents as well, and often goes to stay with her grandparents and loves it because they live on some property in the country and has a really great time. She gets along well with her brother, and there's a very loving relationship actually between her and her brother, which has improved as she's grown and become stronger and well.
Good.
It was mostly that she was having meltdowns. And I think that, as you pointed to earlier, she was irritable, and children don't always have the language to talk about the way that they feel. They just know that they don't feel right. And so they don't have a way of articulating it the way we do, as the way that they feel, particularly when they're feeling unwell. What was the other question you asked me?
Well,
her diet.
Just on that point there. So how did you address that with the child? How did you actually get the story of how she's feeling and what was frustrating her most? What sort of hints and tips can you give us about how to talk to a child, because it's different?
Well, I think for me, it's just being in their world about the activities that they like to do, and what do they like at school? What do they not like at school? Who's their favorite teacher? Do they like sport? Do they like art? What do they do when they're at home? What do they really enjoy doing? What do they miss doing? And of course, in this case, it was, what do you miss eating? Because eventually
Right.
the diet became quite limited, and we can get into that later. For a
Yep.
short period of time, it became very limited, and she was an absolute hero about that. Yeah.
And I would imagine this is also guided by the parents. So we've got to doff our hats to the parents.
Oh,
Not
absolutely.
discipline.
Oh, yeah. It went from a standard Australian diet of cereal, sandwiches, and pasta, and everything wheat and dairy based with quite a lot of added sugars, etc., to the autoimmune protocol as the basis of the diet. So the autoimmune protocol at its most strict is meat, fish, some vegetables, some fruits, no legumes, no grains, no dairy, no eggs, no nuts, no seeds.
Right.
So, and it's essentially like a low reactive,
Yeah.
low antigen diet. And that was the initial intervention while we were waiting for results to come back. So you can imagine what it was like for the family, and for her especially, to go from eating the way she was eating to eating that kind of regimen. Luckily or unluckily, this occurred in Victoria during the lockdown, so she wasn't going to school, so school lunches were not a really big problem.
Right.
Because there was intermittent attendance at school in Victoria during 2020.
Okay. What about just on that diet? So that's a big change for a child to do. Did you have resistance in the beginning from this little girl, or was she quite amenable to just, I need help, I need to change, I need to do
She
something?
really was aware of her situation, and she wanted to be well.
Right.
She even took tablets and capsules twice a day, which is unusual for her age. There aren't many other children that I treat
Yeah.
that could do that.
Yeah. And obviously this was because the parents were on board. What you've said that, they were looking for answers because they were horrified at the potential side effects, but what therefore was the, let's say, the dialogue between you and the medical practitioners?
Well, it was difficult because she was being treated in a hospital setting, and sometimes in hospital settings, you don't always get to see the same specialist in public hospital settings. And I did write letters and make requests, but they weren't always responded to, which I do understand. Again, within hospital settings, they're under a very high patient load already. I think for me, it wasn't necessarily so impactful. I was actually happy to get to see the reports. That's what I was really happy for, is to see the scans and to see the blood work being consistently done, because that actually helped guide my treatment. I could see that the treatment was working because her blood tests were improving over time. I think it was more difficult for the parents than anyone else, because there was certainly a very negative view that was expressed by the specialists about the choice that the parents were making for their child's health. And I was quite surprised that happened. I was surprised that they would be treated and spoken to in that way, because also a parent is already in a very vulnerable situation when they have a sick child. They definitely want to do what's in the very best interest of their child's health. And there's a lot of parent guilt that goes along with that, of, am I doing the right thing? What's going to happen if I do? What's going to happen if I don't? And so a lot of my treatment time was also spent providing reassurance, and also being unbiased, which I am. Like, if my patients had chosen to go down the medical path, I would have supported them in going down that medical path. I have no opinion about it. I supported them in whatever they chose to do. And it just turned out that they chose to follow my treatment model and not the treatment model that was proposed by the specialist. But whichever path they had chosen, I would have supported them either way.
This brings up a whole can of worms about patient advocacy, doesn't it? Maybe we can talk about that a little bit later, but I just want to get into your treatment program, what you did, how things turned out, how the progression, how the symptoms progressed through her treatment, and what was the outcome. Can we delve into, firstly, I guess, the start? So you said that there were some dietary changes. You put her on the autoimmune diet. Did you instigate any supplements at that stage, or was it just diet?
Yeah, I guess because, my clinical experience leads me to believe that anyone with an autoimmune condition has intestinal permeability. And I think that's quite well known and documented. It's not a mystery anymore, even within the conventional literature. So I certainly started with, supplements and nutrients like glutamine as an amino acid, vitamin A, zinc, Saccharomyces boulardii, just because of its benefits in helping the microvilli grow, curcumin because of obvious inflammation, other anti-inflammatory herbs as well. So I was doing a bit of symptom management of the joints to try and get the inflammation down as quickly as possible, and then gut work. And then what we actually ended up doing for a very short period, because of the advice given by the specialists, we did 2 weeks of prednisolone. And that did get the acute inflammation under control very rapidly. It was very effective. Prednisolone is a highly effective drug for inflammation. Yep. However, her parents didn't want to proceed with it because her behavior became so unmanageable on the steroids. Her meltdowns were exponentially increased. So they could see that this was not going to be a practical way forward for them as a family, for her to be on prednisolone. But it did work, I think, in the short term very, very well, and it worked in our favor, because then we were able to build on that gain.
Yeah. I'm not going to ask the dose because that will be adjusted by the medical practitioner, but did you find that the little girl was wired, and maybe a reversal of the sleep-wake cycles? Was she just wired all the time?
With the prednisolone? Oh, yeah, it was everything. She was alert, she couldn't sleep, but she was mostly very angry, like very, very, very angry. And I think that frightened her parents a lot, at how much it altered her mood. Can you imagine 2 years of that?
No. But it makes you wonder what other patients go through, even in adult treatment, condition of adult conditions. Did I say that right? Treatment of adult conditions. I mean, even cancer, we know about why it's used, but that's another tangent. So,
incidentally, about mood, I did discover some stuff through DNA testing and validated with organic acid testing, because I never just use DNA testing on its own, because it's just genetic potential. And so the organic acid testing and the DNA testing indicated, I mean, obviously none of it's for certain, but indicated to me that she wasn't incorporating fats well into her, and because there were a lot of markers in the organic acid test which indicated that fat assimilation wasn't going particularly well. So given that most of your neurons are made of a lot of fat, and also that you use fat as cellular energy, I thought, well, that could potentially account for why her mood isn't great at the moment anyway. So I supported that just through basic things like, L-carnitine, acetyl L-carnitine, and with some B vitamin cofactors. And that was additionally useful because, of course, I wanted to use essential fatty acids as part of her anti-inflammatory protocol, and there'd be no point providing essential fatty acids if she's not going to actually absorb them.
Right. So I was just going to ask you what about simple things like digestive support, whether it be digestive enzymes or even things like apple cider vinegar, or other things that kids might prefer.
Apple cider vinegar, you'd be hard pressed to get that.
I know, you'd have to dilute it.
My dad did it to me when I was growing up. I
I
didn't
used
read
to have hypol
that.
when I was a kid.
Um,
So,
no, no.
so
I
what did
I
you use?
don't
Sorry.
mean as in steatorrhea. I just meant cellular metabolic byproducts that
Ah,
indicated poor assimilation. So she certainly had good bowel motions. That wasn't a problem. Um, and what else did I use? I did use a little bit of NAC just to support her liver, and that just supports also the liver dealing with basically food antigens. And that's a pretty easy thing for children to take as well, because it's available in powder form. Vitamin D, obviously, immune modulating in spray form, because thank goodness it's available in sprays these days. Yeah, so that was really kind of the backbone of my treatment, was immune modulation, direct non-steroidal anti-inflammatory with curcuma, because it's a COX-2 inhibitor, along with boswellia. I think it's COX-1 and COX-2, isn't it?
Curcumin works on a multitude of
Yeah.
inflammatory pathways.
Yeah, and that was really the mainstay of it. I think the diet actually made the most difference,
Right.
honestly. And then when we got the IgG results, there were just some things that we could never have predicted in those results. There was wheat and gluten in there, which was pretty predictable, but then there was a couple of strange vegetables that it was like, oh, well, I never could have predicted that, so we'll take those out. And then gradually, once the inflammation was looking like it was reducing significantly, we looked at how can we now start to reintroduce food groups from the autoimmune protocol back in. So we were challenging and things like nuts, and seeds, different nuts, different seeds. Different legumes aren't so popular with kids anyway, so that wasn't really a big deal. But certainly I think that in the area of autoimmunity, that no patient with an autoimmune condition should eat gluten. I think there's substantial evidence to show that it's counterproductive, even that it causes transient intestinal permeability in healthy people eating gluten. I think if you've got a known state of inflammation, staying away from gluten is a very wise choice. And also, casein from dairy, there's documented cross-reactivity between gluten proteins and casein. So I advise them to stay away from dairy and gluten ongoingly. And as the treatment program progressed, because this has happened over 6 months, her parents have gained more and more confidence with food. And so now they can see that when she eats X,
Yeah.
her symptoms flare up. Or sometimes it might not be her symptoms, it might be her mood. And then the mood is a prelude to, oh, this is not good. This is going to cause something else.
Right.
So they're doing really, really well at the moment. And since that first dose of prednisolone, have not needed any further intervention with methotrexate or pred in the since June 2020.
Wow. That's amazing.
It's remarkable. And her feet look completely normal, like completely normal. You couldn't possibly tell that there was anything different. Her hands, there's no redness, there's no swelling, there's no dermal complications. There is probably, if you looked very closely, some slight enlargement of a couple of joints. They're not actively inflamed, but there probably was some thickening of the synovium that's there. And there is, in an MRI, there's a very small amount of inflammation in one of the tiny little cuboidal joints at the moment. So we'll be monitoring that.
Yeah.
And she'll have another MRI probably in 6 months or 12 months, depending on what the specialist thinks is important. And then if that's an issue, then I suppose we can look at what could be used acutely to deal with that inflammation. But she's gone from a little girl who couldn't do all of her favorite things, couldn't do a handstand, couldn't do a cartwheel. Now she can water ski. I mean, that requires incredible grip strength to hold on to one of those behind the back of a speedboat. Most adults can't even do it, let alone an 8-year-old.
Absolutely. That's quite incredible, isn't it? And like, what joy that must have given you as a practitioner to see to me, it's not just the success in symptoms, it's the success in lifestyle, in
Yeah.
patient outcomes. That's where the real kick is. Rebecca, can I just go back? When you were talking about herbs, you gave turmeric. What about any other particular, let's say, autoimmune herbs, hemidesmus or anti-inflammatory herbs, buplurum, schizandra, things like that? Anything like that? Or was
Well,
it
I was
down to
limited
taste?
because liquid herbs in children are generally incompatible.
Yep.
So I had to choose wisely from different solid doses, and then I also had to be careful of not fatiguing her, because I didn't want her to start to refuse to take the medicines.
Right. So
as well.
supplement fatigue.
Yeah.
That's a
And
very good point.
and she did extremely well. So there was a solid dose that had boswellia, turmeric, and withania, which I thought was a nice combination, and some pisidia, so Jamaican dogwood for analgesia.
Yep.
So that was working really well for her. So we continued that, and I just added in some curcumin. So no, I didn't actually use any specific, I suppose, Romania or hemidesmus or tanacetum, but I had to really kind of balance out patient compliance with effectiveness.
Yeah.
And
maybe a different story in an adult patient where you can just throw things down and tell them to take it. Okay, so I have to ask, did the medical opinion of natural therapies change throughout that? And how was your confidence bolstered because of the results that you saw in engaging with orthodox medical practitioners?
well, there's two things about it, I suppose. Like I said, I was pretty happy to see the blood tests all the time. And so from the time that she came to see me to, I think, more recent, the most recent lot of blood tests I saw from June, her whole white cell count is now completely normal. So she had low neutrophils, lymphocytes, and her total white cell count was down when she first came to see me, and now it's just totally normal.
Wow.
So, which is pretty amazing.
And inflammatory markers are normal?
Yeah, and the inflammatory markers are normal. CRP is just less than 1, I think, the last time I saw it. And so that's reassuring as a practitioner along the way to go, oh, look, what we're doing is actually working. All the blood markers are coming down. And I was happy to have their involvement because, of course, myositis is a very serious complication of any kind of rheumatic condition and can be really life-threatening. So I was quite happy to keep having this correspondence with interpretations of scans that say that they couldn't see any involvement of the muscles. So I was very happy about that. But there was no direct correspondence with me. And it wasn't until, I suppose, the very last appointment that the parents and the patient attended, where the specialist said, finally, I suppose, conceded and said, I don't know what you've done, but her condition is, she's almost completely healthy. There's some small signs, like very minor signs of inflammation. And I'm very interested to find out what you've done, because this is quite a remarkable recovery.
I'm glad that they said they're very interested, because so often we hear, I don't know what you're doing, but continue to do it. Basically, that's the end of it. I don't want to know anymore. At least this professional had the wherewithal to ask what they did for the benefit of future patients. Because, not all patients can tolerate the treatment. It's not a nice treatment.
No. And I do think it's really particularly difficult for parents, because making a decision about your own health is one thing. You're the agent over your own health, but the additional responsibility of making decisions on behalf of another human being, that's massive. And particularly when they're your child and you think, well, and they were being told some pretty harrowing stuff of what could happen to their child if they didn't elect to do the standard and participate in the standard medical care. It was sort of quite threatening language, which I think is personally, I think it's unprofessional. I would never talk to my patients that way.
Mm.
And I don't think it's respectful either. I don't think it's respectful of patient choice.
I actually think that's bordering on bullying. And if you look at professional code, I actually think that would be outside of it. One thing I totally forgot, probiotics. Did you use any?
Oh, yeah, I usually cycle through various different probiotics.
Oh, you mentioned Saccharomyces. Forgive me.
Yeah, I did do Saccharomyces, and I can't see the treatment notes right now, but I probably would have done Lactobacillus rhamnosus GG,
Yep.
probably Bifidobacterium lactis as well, mostly focusing on gut healing. Obviously, there's the additional secondary benefits of when you alter the microbiota, you inadvertently alter how the immune system behaves as well. But I think that's more of a long-term game, using the microbiota to alter the immune system. You can't really, I don't think, rely on that as your first tool with autoimmunity. But I think healing the gut is paramount.
Oh, absolutely. You also spoke of restriction of certain vegetables. Were they the starchy vegetables? What's in my mind is this treatment program that Professor Alan Ebringer in the UK devised, and that was for ankylosing spondylitis. Forgive me, so different disorder, but interestingly, he found a cross-reactivity between a gut infection and certain foods, and so these patients were reacting to high starch diet. Oh, jeepers, I hope I've got that right. Anyway.
Yeah. I think I know what you're talking about. The autoimmune protocol mostly limits vegetables from the nightshade family.
So potatoes, high starch.
Yeah, potatoes, but tomatoes,
capsicum,
eggplant, capsicum, chili. Most spices as well are out of the picture. Right. So it's quite a bland diet. I suppose for children, that's usually not such a big issue because they tend not to eat particularly spicy food anyway. And yeah.
Why most spices? Is it it can't be because of salicylates, can it?
Well, I think the autoimmune protocol is essentially doing similar to what a low histamine diet is doing, but in a much more extreme way. Like it's taking out high salicylate, high lectin, it's taking out anything that's likely to aggravate the immune system.
Right.
So yeah, spices are very high salicylate, and because they're so concentrated, because they're, dried and then powdered, spices can be very reactivating for people, I've noticed.
Gotcha.
In atopy as well, actually.
I've never heard of a reaction to turmeric apart from gut, from massive dose.
Yeah, that's interesting, isn't it?
Yeah.
Yeah.
I was going to ask you a question then about reintegration of foods. How quickly were you able to reintegrate normal, or as close to normal diet?
It had to happen very gradually because we wanted to monitor what, if anything, was her immune system reacting to. So it was quite methodical. And so, yeah, it's, like one food a week, like introduce one food, then observe, see what happens with her pain scores, her mood, with the two most characteristic signs that you could monitor easily. Unfortunately, though, because of course Tamara wanted to expand her diet as quickly as possible, right? Because she wanted to start eating everything. And so she wasn't always honest about how she felt. So kids are smart. That's
might have. What a cracker. Rebecca, there's so much to learn from this, but like I've really got to thank you. I've got to take my hat off to you, not just for your brains and your expertise, which you've gained over many, many years in helping patients such as Tamara, But also, I really take my hat off. I really give my full respect to you for being a patient advocate. And it's something that's, it's harder and harder these days. And you've done this perfectly, to the point that hopefully this resistant professional will have more of an open mind to well-guided, succinct natural therapy programs in the future. I can't thank you enough. You've done such an amazing job. Rebecca, just a last question for you. What's your call out to other naturopaths, seeing as you've gone through this journey?
Yeah, I want to express my passion about treating kids. And I know that a lot of naturopaths have hesitation in treating children, and I completely understand. I know that dosing for children is tricky. You always have to monitor their body weight and make sure that the dosing is safe, etc. But I think there's the hesitation is around that children are really fragile. And I would argue actually the opposite. I would say that children are probably some of the most vital little humans on the planet, and their cells are multiplying at the most ridiculous rate. They are so vital, and their capacity for healing is extraordinary. It surprises me all the time. Like, the results that I get with children in practice actually surprise me. I'm so thrilled with treating them because they do what they're told. They kind of have to because their parents tell them. and they are motivated to get better because they want to be able to run around and play with their friends. But their actual innate vitality is right there, and I think we can harness it. And I would urge other practitioners to go ahead, like, to put aside your hesitations and concerns. And maybe it's like consulting with colleagues. I talk with colleagues all the time about my cases. I don't assume that I know everything, and if I've got concerns or hesitation, then I discuss them with my colleagues to be able to give myself some peace of mind. But I think in pediatrics, there's not a lot of options. Parents aren't presented with very many options for their children's care. And whereas adults can freely choose, they can go and do the research, they can choose what avenue they're going to go down with their health. But with parents and children, I don't think there are too many options beyond standard pediatric care. So I say go for it and treat some kids. They're lots of fun.
And learn from experts such as yourself. Rebecca, I cannot thank you enough for sharing your wealth of knowledge, but also your compassion for your patient in leading them through this juvenile idiopathic arthritis. And Tamara, no doubt, has a great outlook thanks to your care. But also I want to thank you sincerely for being such a patient advocate. It's rare to find, and we really need them in today's modern healthcare system. So thank you for your work and your care, but also for taking us through this case history on today's chat with the Health Chat.
Thank you. It's a pleasure and a privilege.
And thank you for joining us today. Now, remember that you can catch up on all the Health Chat podcasts with Ricky, Vicky and myself, but also Tech Talk from Optimal RX, and you can catch them all on your favourite podcast channel or at obornhealth.com.au. This is the Health Chat. I'm Andrew Whitfield Cook.